Good morning, everybody. Wakey, wakey. It's time for Morning Glory. My name is MC Kalia, and I'll be your captain for the next 1 hour, 30 minutes. Let's have this conversation going. Good morning, everybody. Wakey, wakey. It's time for Morning Glory. My name is MC Kalia, and I'll be your captain for the next 1 hour, 30 minutes. Let's have this conversation going.
Topil Hospital, a brain and spine specialty hospital dedicated to providing extraordinary care through competent doctors and other medical personnel from premium institutes with knowledge on the latest and exceptional medical technologies. With a capacity of over 70 operational ward beds, over 30 specialists and consulting doctors, Topil Hospital is a modern level 5 facility equipped with 12 state-of-the-art ICU HDU beds and 2 modern HEPA-filtered theaters with laminar airflow. Our aim is to provide comprehensive quality services at an affordable cost to the community, which includes but not limited to neurosurgery, radiology and diagnostics, MRI, CT scan, X-ray, ultrasound, endoscopy, ECG, EEG, pediatric cardiology, physiotherapy, orthopedics and trauma, pharmacy, laboratory, theater, ICU and HDU, obstetrics and gynecology, general surgery, maternity, psychology, psychiatry, comprehensive wellness checkup, dialysis and urology, oncology, dental care, ENT surgery, nutrition and dietetics. For ease of movement and transfer of patients, the hospital has 2 modern critical care ambulances equipped with ICU facilities and available 24 hours. Topil Hospital is located in a serene environment away from noise and has a cafeteria with fresh, nutritious foods, not forgetting ample parking for all clients. Topil Hospital is NHIF accredited and accepts medical covers from a number of insurance companies. If you're looking for the best customer care and patient experience and to be attended within the minimum waiting time possible, reach us through the website www.topilhospital.com or call 0782 121214, or you can also call 0782 900090. You can also email us through info@topilhospital.com. Topil Hospital, exceptional technology, extraordinary care.
The 24th day of May 2023. My name is MC Kalia and this is the Morning Glory Show. Welcome to this particular show. Being a healthy, wealthy, wise Wednesday, we are here to improve our health education. And with us this particular morning is Dr. Nathaniel Mwadime from Topil Hospital and also Abraham Tanui, who happens to be a testimonial this particular morning that actually spine degenerative disease can actually be treated through surgery. But then before we come there, allow me to also remind you that we are coming live from Dawi Afrique Photography. Dawi Afrique Photography is a production house based in Eldoret, Zion Mall. Now, remember that we also have a wing that deals with safari, and this time I would want to bring to your attention a safari that we've organized. We'll be going to Rimoi, that is in Elgeyo Marakwet County. So on the 18th and on the 17th and the 17th and the 18th day of 2023, that is June 2023, then we shall be going to Rimoi. So make sure that you join us as we go there to explore. If you want to see the biggest elephants, then that is where you find them. So on the 17th and the 18th day of June 2023, we shall be going to Rimoi. I know why this sounds like one of those matangazo ya kanisa. Anyway, so see you then, and let's join hands as we go there to have fun, as we go there to camp and to experience the marvelous, the amazing Rimoi Park. Also, in addition to that, allow me to remind you about dressing for a minute. So if you need to dress to be addressed, I'm sure you must have seen Daktari's suit. Don't use me this time. So use Daktari's suit this time. So make sure that you walk into D Square. D Square Fashion House is situated at the fourth floor of Ketia's building in Eldoret. So I can see my director now trying to be cheeky and zooming in Dr. Mwadime. But then make sure that you walk into D Square, because that is where you get the best dressing. If you need to dress to be addressed, walk into D Square Fashion House. But then if you need to take up fashion as a career, then consider also walking into D Square School of Fashion Design. D Square School of Fashion Design is also situated at the fourth floor of Ketia's building, providing an opportunity for you to also learn from those who are already working in the fashion house. So make sure that you do that. Now back to today's topic. As I hinted to you, we have Dr. Nathaniel Mwadime. We were with him last week. We've been with him. This is not the first time. But then of course there are those who may not necessarily have met him, because every time our following is growing. So Daktari, say hi to our viewers.
Morning everyone. It's good to be back here again. I'm Dr. Nathaniel Mwadime from Topil Hospital. I'm a resident medical officer from Topil Hospital.
Okay, thank you so much, Daktari. And also besides Daktari is Abraham Tanui. Now, I'll tell you about Abraham Tanui in a minute, but then allow him, first of all, to just say his name and a little bit about himself.
I am Abraham Tanui. I'm one of the people who were treated at Topil Hospital, and I'm now faring on well. Yes.
Okay, thank you so much, and welcome to the Morning Glory Show, gentlemen. Yesterday I had a set full of ladies, and I promised myself and my viewers that today we are going to revenge. I thought this is a classic revenge, because it is a bench made up of men only, but then for a good cause, just to talk about improving our health know-how. Now, the last time we were here with Dr. F. Koech, I remember him sharing statistics with us that by the time we are 25 years old, about 25% of the people present with spine issues, and most of the time it is issues to do with the discs. By the time we are 40, then 2/3 of the people will present with also such conditions. By the time we are 60, 90% of us would have in one way or the other encountered a spine complication. And that's why we are here exactly to talk about one of those complications called degenerative spine disease. And as we talk about it, Abraham has walked through that journey. He experienced lower back pain, and upon investigations at Topil Hospital, it was discovered that he had a degenerative spine
disease. And so this particular morning, he will be sharing his part of the story, of course, his experience in his own account. And then we also have Daktari to also add in some more knowledge and to help us understand how to overcome this particular disease. And so before we go to Abraham, let's start with Daktari. Daktari, please tell us about this particular disorder called degenerative spine disease.
Yeah, so degenerative spine diseases are basically those kind of diseases that happen due to the process of aging of the spine. So just like any other part of the body, the spine also goes through an aging process. So the structures that make up the spine, the bones, the discs, undergo that gradual process of aging. So it of note is that this is a normal process that happens in everybody. All of us will undergo aging of the spine. So ideally, this aging process takes place gradually and happens as we grow older and older and older. So when you happen to do an image of a spine for someone who is blessed and is at 90 years old, and to do an image of a spine of a 25-year-old, there will be certain changes that you'll see in the 90-year-old that have occurred for this kind of spine. So the discs that connect the bones of the spine will be worn out. Edges of the bones of the spine will have undergone things called osteophytes formation, whereby it's excessive bone formation on that side because of aging. All this arthritic process is what we term as degenerative spine diseases. So of note is that now this, as I said earlier, is a normal process of aging of the spine. But now there are factors that make this process happen faster. And when this process happens faster than it used to be, we have certain symptoms that come in, which the major one being pain on the back. Now, and another issue you'll hear patients talking about is nasikia uchungu pia inaenda kwa miguu, because the structure of the spine ideally protects the spinal cord and also allows for nerves to come out of the spine and to go to the rest of the body. So when you have a degenerative process of the spine involving the discs themselves, can lead to compression of these nerves. Now, compression of these nerves will lead to pain in that particular region that the nerve supplies. So if, for example, you have degenerative spine disease of the lower back I'm meaning the area karibu na kiuno. So if you have degenerative spine disease out of the lower back, and it's involving the nerves at that region, you'll hear patients complaining of pain that is going to their legs. They'll complain of numbness going to their, wanasikia miguu imekufa ganzi, ama wanasikia miguu imeganda kabisa kama barafu. Mwingine atakwambia nasikia miguu inanidunga, nasikia niko na sindano zinanidunga kwa ngozi na kwa miguu. Yes. So those are some of the symptoms that are associated with nerve involvement of the spine. Yes, so of note is these are diseases that are beginning we see them more commonly because of the lifestyle changes. So as I told you, because this is an aging process that occurs in our body. So factors like trauma, so being involved in accidents or having multiple falls, factors like infections of the spine, so infections like TB of the spine, and then other factors like tumors in the spine. Growths of the spine can accelerate this process and make it occur faster than it should be. So when pain is involved and excessive pain becomes unbearable to the point that it impairs the patient's day-to-day life. So the patient can no longer walk straight. The patient complains of numbness or pain of the legs every time. He's been taking painkillers, it's not helping, and that's the time now we doctors and surgeons do come in to be able to help this patient elevate the pain so that you can be able to continue with your normal life. Yeah.
And of course, Daktari, so many questions. I can already see questions about different types of pain on the spine, and I'm sure we'll be able to discuss them as we go. So if you're at home and you have any questions to ask Daktari, make sure that you ask those questions. Of course, I'll be passing them to him when chance and opportunity comes. And now coming to you, Abraham, first of all, tell us about your experience. What did you start feeling and how did you end up opting for surgery?
First and foremost, initially I started feeling a kind of numbness in my right leg. Say that it was a feeling like I remember those days when we used to go to hospital. When we get an injection, you feel your leg like numb and unable to walk well, something like that. So it started like that. At some point, I went to hospital and I was told this is an issue of nerves, that I need to take some painkillers and neurobins and do a lot of exercise and try my best to reduce my weight, which I actually did. I went, took the drugs, started doing some exercises here and there every evening after job, and the pain disappeared a little bit. And I started feeling well. And it reached a point where one time we went to the field to play football, and I was appointed to be a goalkeeper. So I played football, we played football, and I actually manned the goal in such a way that hakuna goal hata moja iliingia. But at the end of it, when we were out of the field after the game, I was feeling very terrible. So I came, when I reached town, I went to the chemist, explained to them what I've undergone, the football game that we were playing. And the person who was at the chemist told me that this is just something minor. Maybe just dip it and some painkillers and you will be okay. So that is what I did. Nikachukua painkiller, nikachukua dip it, nikaenda nyumbani. Na nilipofika nyumbani nikatumia painkiller na dip it. And that was, I remember it was on a Wednesday. And when I woke up on a Thursday, I was feeling a little bit well. So nikaenda job, tukaendelea kazini. Come Friday, I was feeling terrible. I was not feeling well. Nikakuja, nikalala in the morning. On Saturday, nikasikia sio mbaya. And then I went ahead again and took a knapsack, 20 liters of knapsack, and sprayed my cows. And by the time I was almost finishing, nilisikia very terrible pain. And from that time, I now realize that I'm actually very sick. So nikachukua zile painkillers na dip it, nikaendelea just like that. And then on Monday, ikabidi niende hospitali. Nikaenda hospitali, nikapata Dr. Bowen. Dr. Bowen requested for an MRI. So I went and took an MRI. But the pain was very terrible. I could not walk. Nikitembea kidogo hivi about 10 meters, inabidi nikae chini kwanza. And all that. So Dr. Bowen alipoona MRI report, akasema this is so bad that I need to undergo surgery. And to me, surgery was something which was it is an experience which I really didn't want to undergo. So daktari akanipea some painkillers, akaniambia go and seek second opinion. So nikaenda nikachukua dawa, nikaenda nikameza na seek second opinion. First of all, family members were saying no, you should not undergo any surgery. Let us try another way. Tukaenda mambo ya physio, tukajaribu physio for about 4 days, lakini ikaendelea kuwa mbaya zaidi. And I remember nilienda kazini on a Friday, but kufikia saa 8 nikasikia terrible, nikasikia mwili iko mbaya. Nikapigia my brother, nikaambia kuja nichukue. Na nikaambia just take me straight away to hospital. I don't want to go back home. Just want to go straight to hospital. And On our way, we called Dr. Bowen to ask him if he can prepare the surgery table ready, because I was in a very terrible pain. And I didn't want to hear any other story of that I should not go for surgery and all that. So tukapigia Dr. Bowen. Unfortunately, he was going out of town. So ikabidi tu ni ngoje. And then on Monday, we went to Topil. That is 13th of March. We went to Topil. Na tulipofika Topil, tukapata Dr. FKH, tukamuonyesha the MRI report, akaona na akasema nao tutawasaidia, nitakusaidia. So alipoona the MRI report, akanieleza everything, how the discs are and everything, akaniexplainia vizuri mpaka nikaridhika na nikasema mimi nataka surgery sahi. Unisaidie kabisa kwa sababu niko in a terrible pain. Na Dr. FKH akanisaidia. I remember it was around 3 tukimwona. And then at around 4 I was admitted. And at around 7 p.m. nikaambiwa usikule chakula, tutaingia surgery. And around 8 p.m. tukaingia surgery. Na nikapelekwa. I remember when I went in to the surgery room, right at the door, the guys who were assisting there picked me up from the wheelchair and placed me on the stretcher. Or what do we call that? That kind of the table, the surgery table. And I was in a very terrible pain. I told them, no, please, I have to sleep in a certain formula, a certain way. And wakachukua dawa na wakanidunga tu saa hiyo na nikalala tu. So na nikapelekwa kwa surgery. Nilijikundua tu at around 10 p.m. Nilipoamuka, I remember when I became conscious, I just remember asking asking who is around here to come and explain what is happening. And then the nurses came. One of the nurses came and called my name, Abraham. Abraham, how are you feeling? Nikashangaa kumbe hao watu wananijua. And then now I remembered, kumbe nilikuwa nimekuja hospitali. Kumbe nilikuwa nimekuja kufanyiwa surgery. And then one thing that came to my mind ni kwamba wacha let me test whether my leg is now okay. Na nikanyorosha tu mguu hivi. Kunyorosha mguu nikasikia there is no pain. I'm not feeling any pain. It's not like when I was going in for surgery. So there was no pain. And then I stretched the other leg also to find out maybe the pain has shifted to the other one, and there was no pain. Na nikakuwa very okay. So it was a miracle to me kwa sababu it was instant healing. So what I was left with was just the issue of the after surgery issues and all that.
And of course, allow me to interrupt you. We'll now come to the recovery process, but then before we go there, ndio tusiwache watu wengine nyuma. Of course, I can see a few comments here. Alfred Coed, Sergeant from Australia, says good morning, following and learning. Thank you so much. Savannah Boy says good morning too. Then there is a question here that Dr. will answer among the other questions that I'll still ask you. Is say my back feels like it's 90 years old when already due to 2 C sections. I have had. Okay, she's under 30 years old. I think that is what she means. So she feels like her back is paining too much. She has had 2 C sections. And she's below 30 years old. DJ Thew says good morning. Now, Dexari, in addition to this particular question, Abraham has explained his reluctancy, first of all, to opt for surgery. Of course, we are coming into now interventions that that can be there for such kind of pain. And I'll ask you the question: what are some of the myths and misconceptions that people come to hospital with about surgery? Or the question should rather be, then why are people so reluctant to accept being taken in for surgery?
So, first of all, let me answer the viewer's question, where she was asking that she's less than 30, she's had 2 cesarean sections, she feels like her back is that of a 90-year-old. I believe what she means is she feels a lot of pain on her back, or a lot of heaviness on her back. So my answer to her will be, you see, can I say unfortunately or fortunately for our ladies, because of pregnancy in itself takes a toll on their bodies. The growing child needs calcium, a lot of calcium, and all the other nutrients. And calcium, as you know, is a very important mineral for bone formation, both on the baby, and also a very important mineral for stability of the bone on the mother. Now, and that is why we give calcium supplements to our mothers. We tell them, give them iron supplements and all these kind of supplements, tell them to eat well, so that the baby can get this from the nutritional aspect instead of the body breaking down itself. And also the weight of carrying the young growing infant in their wombs. You see, the whole spine undergoes degeneration, but now there are parts of the spine, because of their weight bearing capabilities, do undergo degeneration faster than the others. Now, these parts of the spine are the lower back, we call the lumbar spine, and the cervical spine, the bones that carry the weight of the head. So because they are of their weight bearing aspects, the degeneration there occurs faster as compared to the thoracic spine. So because of that, and see, the baby grows in the womb, which is found in the pelvis. The pelvis has a proximity to the lumbar spine. So the weight of the baby, as they carry, also takes a toll on their lumbar spine. So because of this, you'll hear mothers, the patients I've seen, complaining of pain that actually started after they delivered their first child. They tolerated the pain. It was on and off. Then they delivered the second, the third. By the time they're delivering the fourth child, they're saying the pain is unbearable. Others, within the first and second child, the pain becomes unbearable. So for my advice for her will be to come to hospital, so that we can be able to do a test. We usually do an MRI of the spine. It does show us the bones together with the discs, the intervertebral discs and their nature, and it also shows us the nerves, as the spinal cord with the nerves as they come out of the spine. So with that kind of assessment, we can be able to help her to be able to see the kind of management that she actually needs. Surgery is usually the ultimate solution, or we give it the last solution for these kinds of pain, because degeneration is a process. So patients come to us at different stages in the process. Now, the worse the pain, the more the degeneration, and the worse the spine is. So just like Abraham talked about, his pain was unbearable. I have seen patients who come to me and they're telling me, Daktari, the kind of pain I am feeling, childbirth was better. See, that's how they tell you, because the pain is unbearable. They can no longer walk again. After Abraham talks about 10 meters, others say, when I walk a few steps, I feel I can't walk again. It's too much. The pain is too much. Mwingine anakuja ananiambia, daktari, the numbness, nasikia miguu yangu, I can no longer feel my legs anymore. Hata ukijaribu kunishika hiyo kidole, daktari, sijui kama iko hapo, because of how severe the numbness is. Mwingine anakwambia, I cannot sleep in the night, it's usually very painful. I feel piercing pain, pins and needles on my feet. I can no longer sleep. I have to use 3 blankets on my leg. It's very bad. Mwingine anakuja anakwambia, it's too hot in the night. My legs are even sweating. So when the pain is that unbearable, surgical option is done to elevate this kind of pain. But sometimes others come to us in the earlier stages, whereby we can do conservative management. And by conservative management, I'm talking about we use medications, we tell them to do physiotherapy, we do lifestyle changes for them, have heavy duty work, we reduce, and all that kind of stuff. We told them to reduce heavy duty work, to reduce bending a lot on their spine. We trained them on how to pick things from the ground and how to bend and how to take care of their spine so that we can reduce the fastness at which this process does occur. Yes. So for my advice for her will be come to hospital with an MRI spine and with an assessment that we do as doctors in the hospital. We can be able to tell at which stage they are, and we can be able to advise them the best option that we can give to them. Yes.
And of course, the question, a follow-up question, and this one has come to the inbox, is that can that pain now prevent someone from getting pregnant again? And of course, I know I'm adding a question on top of another one, but then because it is a follow-up of that, I'm sure we may want to answer it before you go to the other one, why patients are reluctant to maybe opt for surgery.
The lumbar spine and the pelvis, yeah, they are connected, but not in such a way. So even with the pain, you will still get pregnant, because the process of getting pregnant can still go on. As long as a sperm and an ovum meet, you will still get pregnant, and you will still deliver the baby. The problem will be the pain that this patient is undergoing, but you will get pregnant, you will carry the baby to term, and you will deliver the child, but the pain will be the major issue. So on the other question about the myths that people have and why people fear surgery, we are humans. Everyone, when you're told that you need to undergo surgery, which is we call them elective surgeries, you need to undergo surgery because of a certain thing. The first response we have is no, wait. Everyone has a feeling of not wanting to go to surgery. You want that to be the only the last option. So most of the myths that people have in regards to spinal surgeries is because when they hear we are going to do a surgery of the spine, the first thing that other people will tell you out there is, hey, daktari, sinaona mimi nikiguswa hii spine nitakuwa paralyzed. Yes, because when you talk about the spine, people will think they automatically go to the spinal cord itself that controls, that has relay information from the brain. So the myth is, daktari, ukinigusa mgongo, mi naona sitatoka nikitembea. And I'm sure Abraham will tell you that's what people were telling him just before he went to surgery. Hey, are you sure you're going to walk again when you get out of the surgery? So when we talk about degenerative diseases, as I said earlier, it involves the structures that support the spine. So the bones and the intervertebral discs that have a degenerative process. So this kind of pain will result from the degeneration of these organs. And when this degeneration and this, for example, the intervertebral disc ends up compressing the nerves, and that's the time you hear people talking about pain going to their legs, having numbness, severe numbness on their legs, having severe pain that is going to their legs because the nerve is getting involved. So when neurosurgeons and spinal surgeons, to be more specific, when they do go in for this kind of correction, what they actually do is they correct the structures that are actually degenerated. So they will correct the discs that have been degenerative in such a way that they are compressing the spinal cord and spinal canal, and they are compressing the spinal nerves. They will correct the bones in case probably there is a fracture there, or the bones have been completely degenerated to the point that the alignment is not good. So they will make correction to the bones and use things like implants to be able to fix the bones. But they will not touch your nerves, and they will not touch your spinal cord. So the myth is that people usually have more so for spinal surgeries is the fear that you'll come out of the table when you're not walking again. Yes.
Okay, thank you so much for that. Of course, more questions coming in. Don't hesitate to send them. We'll get time for Daktari to answer them. Now let's get it from Abraham. Of course, he's been there. And somehow Daktari has hinted this. What are some of these things that people told you, Abraham, when you went now seeking second opinion? Of course, I'm sure you must have went home and told your people, now I'm supposed to go for a surgery. How was the reception at home? Who first of all came to your mind, apart from the doctor, to inform them that you were supposed to also go for a spine, to undergo a spine surgery? And how did they take it?
Well, when I was told by doctor that there is no way out, I have to undergo the surgery, the first person I informed was my wife. And my wife sort of was not all that, she was very okay. She said, if that is what Dr. has said, then let's go for it. Because at the end of the day, it will be very, it will come out successful, because Dr. has said that that is the only way. And then the second person I called was my mom. And my mom sort of felt, no, let's wait. Let's try another way first. And also my brothers, I told my brothers, and my brothers also said, no, let's try another alternative first. Before we go for surgery, let's try another alternative. And that way, I got more confused. And we had an experience of our dad. One time, our dad, who was around 70 years, was taken in for spine surgery. And for his case, it was the upper side of the spine. Na alipofanyiwa surgery, it took time for him to actually heal and pick up. So we had that confusion that supposing such a thing happens again, in my case, what will happen? But after trying all those other ways and waiting for a while, the pain continued na ikakuwa too much to a point penye niliona tu, there is no way out. Wacha niende for surgery. And then I called my mom. I told my mom, the pain is becoming terrible and I cannot hold anymore. Let's go for surgery. And there, my mother akakubali, na all our people wakakubali, and then we started the journey and went and met FCOH. So we explained to FCOH our feelings, our thoughts, and everything. Na FCOH akatuexplainia, akatueleza about the upper spine, the lower spine, and all that. And na akasema kwamba the lower spine is not that much very risky as such. Once ikifanywa tu vizuri without touching the nerves and all that, you will come out successful and you will not have any pain. And actually that is what happened. Yes. Okay,
and somebody will ask, what was going through your mind at that particular time? Of course, you are in pain, but then what was really going through your mind?
What was going through my mind was that now, supposing we go through the surgery and everything fails, what is going to happen? How am I going to carry on with my life? Caring for a person who is unable to do his own things is a very different story. It is so hard, and people in the household, in the family, will not be thinking of any other thing to do, but most of the time people will just be coming to take care of this sick person. Na nikafikiria sana na nikasema, nao kazi itakuwa namna gani, tutaendelea na maisha namna gani, maisha itakuwa ngumu and all that. Na bottom line, nika trust God, nikasema kwamba my God is my healer, and I know God is going to use the doctors and I'm going to come out successful. And for sure Mungu alinisaidia na nikatoka successfully, na nikakuwa sisikie any pain, na nikawa nimepona kabisa. So nilisikia sawa, Mungu alinitendea.
Thank you so much. And Dr. coming back to you, of course, this is not the first time you've mentioning this. You've mentioned about early intervention for conditions. And in this particular case, you realize that at some point, Abraham had to go to a chemist. They just gave him deep heat, and that may not have helped much. How do we know that it is now time to visit a hospital? Like, of course, you've said it's something that is continuous, that is degenerative. At what time, what kind of pain is a signal, or what kind of symptoms is a signal that now this could be something that cannot just be solved maybe over the counter?
So what I do advise people out there is I cannot really tell you at what degree you want to come to hospital, at what time is the pain unbearable to you. We do have different thresholds of pain for different individuals. By threshold, I mean there are people who can take much. So at what threshold do you have? So my advice will be, when you do undergo a traumatic process. Abraham talked about playing football. He fell down. He felt a lot of pain. So when you do undergo a traumatic process in your life, whereby you fell down, probably from a height, on your back, you're feeling a lot of pain, or probably you're involved in an accident and you're feeling a lot of pain, the best thing is to actually come to a hospital so that we can actually investigate further. And then we can tell you if the process is just as you had earlier from the talks that Dr. F. Koech was here earlier talking about 25% of individuals from the age of 25, 2/3 at the age of 40, and almost 90% at the age of 60. This can tell you that the process happens over time. Now, there are these factors like trauma that come into play, infections of the spine, tumors of the spine. But now I'm going to talk about trauma. So if you're involved in a traumatic process, either you've gotten an accident or you've fallen down, you've been involved in a road traffic accident, and you're feeling severe pain on your back, it is important to actually go to a hospital so that they can investigate. Then we can tell you whether it's bad enough that we need to correct surgically, or we need to do conservative management, and we do help. And we tell you the kind of things that you should not do so that the process does not get worse. Because remember, this is a degenerative process. It occurs over time for everyone. So we'll talk about posture, how you should be sitting in the office, which kind of loads you should not be carrying, how you should pick up objects from the ground and things like this, so that this process does not go on in a faster way. So, and when the pain becomes unbearable. So there are those individuals who will ignore the pain to the point that it becomes unbearable. When the pain becomes unbearable on your back, you can no longer sit, you can no longer stand for long, you can no longer walk for long. You're having severe numbness of your feet. You're having severe pain on both of your lower limbs, the legs. You're having a burning sensation on your legs. When the pain becomes unbearable, you should come to hospital so that you can be able to check. And at that point, surgical intervention might be the best option for such individuals, because of our major issue when we're talking about as doctors is to elevate pain. Yes, so when the pain becomes unbearable, you come to hospital so that you can be able to help. And usually surgery now becomes the best option for these individuals. Yeah.
And of course, when you mentioned that everyone has a threshold, it reminds you of a book by Francis Imbuga that everyone has a boiling point, just like water. Or rather, I think there was a melting point. So at times it's calculated, when you're in prison, it is calculated at 2 strokes. And then you'd be able to tell all the mistakes you ever did. Anyway, this is the Morning Glory Show. With us this particular morning is Dr. Mwadime from Topil Hospital, and Abraham Tanui, who is also a survivor of degenerative back disease. And as we continue to discuss this particular show, of course, feel free to send in those questions. And the next question that will come to you, Dr. before we go back to Abraham, is Beatrice Sikering is asking a question. My work involves a lot of sitting down for like 8 hours every day. Once I'm done, I feel pain on my lower back. What can you advise? And in addition to that, of course, now give us what are the other risk factors that that apart from maybe aging and all that, let's now discuss in detail the other risk factors that may fasten or rather make it worse for those who, because you've now said all of us are going through these things. So what are some of these things that we need to be aware of as we continue to age?
So first, to answer Beatrice's question, my advice to Beatrice, yes, you do work in an environment where you sit down for 8 hours. We advise patients that, or individuals that sit down for such long hours, to use orthopedic chairs. An orthopedic chair, simpler terms, the classical office chair that follows the curvature of your back. And secondly, yes, you sit down for 8 hours, but you, my advice will be to stretch a bit in between the 8 hours. Probably within 2 hours, you stand and do simple stretches that you can do in the office. Either you stretch your back, you a bit bend, just stretch yourself out so that you can be able to sit down again and continue. It is not advisable to sit down for 8 hours continuously, even if you take a lunch break. But sitting down for all those hours without actually standing up and stretching a bit. As you go to the washroom, you stretch a bit, you come down, or probably after 1 to 2 hours, you stand, you stretch a bit, then you sit down, and then use an orthopedic chair. It's very important because it follows the curvature of your back. And for someone who is sitting for 8 hours like her, using an orthopedic chair that has a headrest is very important, because that will help this individual to be able to reduce the instance of pain on such an individual. Yeah. And as to talk about the risk factors that I mentioned earlier that make this process go faster. So things like infections. Most common infections of the back, the spine, are TB infections. So that's why it's very important to treat TB in the community out there. The government is making outreaches, is making pleas that someone with a chronic cough, go to hospital, get investigated for TB and get treated. The reason being, TB does not just affect the lungs, it affects each and every organ in our bodies. And if it gets to affect the spine and gets to degenerate the spinal bones, you can have fractures. We call them pathological fractures of the spine, because the nature of the quality of the bone has been reduced, so it is easier for it to fracture. When that happens, this degenerative process will have been fastened enough so that we need to intervene earlier enough. So infections like TB, very important to diagnose early and treat early. So for the population out there, the campaign has been, you have someone with a chronic cough, you have a cough, it is good that you be tested for TB. If you've come close to contact with someone who is on treatment for TB, it is good to get screened for TB also, so that it can be treated early. Because the mode of entry is mostly through the airway. So you have interaction with someone who has a chronic cough and has had TB, you can easily get TB of the lungs. But when it gets to the lungs, it can, for lack of a better word, be transferred to other parts of the body. So infections like TB, keen to treat them as early as possible. And then we have tumors of the spine that come into play. These are, if you happen to have a tumor of the spine, unfortunately it will accelerate this process that we need to intervene surgically early enough. Then there are those modifiable factors. We call them modifiable because it's something you can control. So trauma events, if you're involved in an accident or you're involved in an activity that involves a lot of trauma of your back, it is very good to take care of your spine. So that's why you'll see professional sports people having physiotherapists that are attached to them. These individuals will be able to train them on how to take care of the spine. They undergo physio oftenly so that they can be able to take care of the spine, and that's so that this process doesn't occur faster than the rest of us. So the thing is, you will delay this process, because if you're physically active and you're a sports person, I will not tell you to stop it. Compared to someone who is having a sedentary life, might be able to have these degenerative diseases earlier than them, but that doesn't mean you stop doing what you're doing. You just need to have a professional by your side who can help take care of your spine. And that's why you have athletes. This is a region where we have a lot of athletes. That's why you have athletes having their own personal, they call them physios, their own personal physiotherapists that will help them on how to train, on what to do, which kind of exercises to actually do, so that they can help take care of the spine and other joints that are actually involved in pressure movements. So here comes the hip, the knees, the ankles, that will degenerate faster because of the process that they are doing. Then for those with a sedentary lifestyle that live in the office, like Beatrice, now lifestyle modification comes into play with the kind of chair you're going to use. Having office stretches each and every time so that you can be able to reduce the instance of feeling pain. And then as Abraham I talked about earlier, you hear people telling you reduce your weight. This becomes very important for people in an earlier stage because this is a degenerative process. So obesity comes into play because the more the weight, the faster the process. I talked about earlier the cervical and the lumbar spine being the areas that will have more instances of degeneration compared to the thoracic spine at an earlier stage. This is because they are weight-bearing parts of the spine. And now obesity increases the risk of degeneration for these patients. So you're having a sedentary lifestyle, but you don't exercise enough. And with the reduction of obesity, simple exercises like aerobics, swimming, things that have a catabolic nature in our lives. So they reduce calories. They reduce calories in our body. Those are the kind of exercises I'm talking about. So you can either brisk walking a lot, or going for swimming, or going for aerobics, so that you can be able to reduce your weight. So when you take care of your BMI and reduce obesity, it plays a bigger role in reducing the process of degeneration in your body. So when you're having a sedentary lifestyle, it's not only sportsmen who get these things. People with a sedentary lifestyle, your weight has increased and you're no longer doing exercises. The higher chance of degeneration process happening faster is higher on you than compared to someone else. So you'll end up that these people will be seeking intervention at an earlier age. But when we come to us and you go to a hospital and you're having early stages of degeneration, then the doctor tells you you're going to do conservative management. Part of it is reducing your weight. When you do that, the pain reduces enough. But when you come to us and you're at a higher stage and the degenerative process has occurred so much, we'll tell you conservative management will not help you because at this process the degeneration has occurred so much. So we need to correct it surgically. Yes.
Okay, thank you so much for that. And now coming back to you, Abram, let's talk about the recovery process and whether this has had any lifestyle changes on yourself.
My case, first of all, is a sedentary kind of lifestyle because I work in an office and I have been working since 1997 in an office. So my case is a sedentary kind of. Currently, ninaendelea na recovery. Remember, the surgery was done on 13th of March. It's about 2 months and some 3 weeks, something like that, yes. Naendelea na recovery. Like when I went for a review just the other day, the doctor told me that I should not sit for long before stretching myself. That the longest I can sit is maybe 1 hour, and then maybe stand up and stretch myself, and maybe continue now with my work. Drugs, nilitumia drugs from the time I was discharged. Nilitumia drugs for almost 1 month. And then after 1 month, drugs ikakuwa reduced. Na currently, ninatumia drugs whenever I feel any pain. Otherwise, I'm now free from using drugs. Na ninaendelea vizuri. The only issue that I sometimes feel is numbness, which has actually reduced. It is not like how it was. Na currently naendelea kureduce, nasikia naendelea kupata nafuu vizuri. So naendelea na kufuata maagizo ya daktari kama vile nilivyoambiwa, na I'm doing well. I'm doing well.
We're glad that you're actually doing well now, Daktari. As we start to close in, tell us maybe about now the recovery process. Such a patient, of course, Abraham says he still feels numbness from time to time, but then generally the quality of life has improved. Would he be able to get back to what was before, maybe the excessive degeneration? And also, let's talk about the care for such a person, personal care, and also the people around him.
So now this will be different depending on how much damage had occurred, for lack of a better word. So when you have degenerative spine diseases and you have intervertebral discs that compress your nerves severely to the point that there's someone who will come to us and tell us they can no longer feel their feet. It is so numb they can no longer feel their feet. So remember, this recovery will take time. Daktari does not touch your nerves. He takes care of the discs, he takes care of the bones. The nerves have to heal on their own. So this healing process will take time. So some individuals will tell you within 2 months their numbness has completely gone. Some will take a year before their numbness goes away. So the recovery process will depend on how much damage that the patient had undergone. So all in all, is pain will be the first thing that will go away. That pain that you are feeling that is so severe on your back and going to your legs. That's, as Abraham has told you, the next morning he woke up and he said he stretched his legs and he could no longer feel the pain he was feeling. The only thing probably that remained was the post-surgical pain, and that's why alipatiwa painkillers akienda nyumbani. But after a while, he's only using painkillers when he feels a bit of pain. But that initial pain that you had, that is the first thing that goes away. So pain goes away completely. You can be able to resume your lifestyle. You can be able to go back to work and do your things because the pain will go away. So things like numbness will take a bit of time to clear, pole. Sometimes you have it to the point that if the damage is so severe on the nerves themselves, things like numbness might not completely go away. Because now this is not a perfection job. We are trying to correct whatever problem we have. So the pain is, we're going to take care of the pain that it goes completely away. The numbness will greatly reduce to the point for other individuals, if the process was not very bad, it completely goes away. For others, it will greatly reduce to the point that they tell you sometimes I feel numb, sometimes it's not there anymore. So the quality of life will greatly improve. On your second question about
do I still remember my question? Of course, the care that they need to have for themselves and also what people around them should be.
On the care that people have for themselves, post-operatively, we do tell them to take care that they don't fall down. Trauma will increase the pain that they're actually feeling. So falling down or any kind of trauma will really greatly increase the pain that they were feeling. So we tell them to take care of that. We tell them to take, there will be a bit of change in their lifestyle. We tell them to avoid bending a lot. We tell them to avoid carrying heavy objects. And for someone who sits in an office, he'll be advised, like Abraham has been advised, that he should not sit for long hours. Just the kind of advice we give for people who have early degenerative disease, and you're having a sedentary lifestyle, don't sit for long hours in an office. Use an orthopedic chair. And when you're sitting down, if your work involves sitting down for long hours in an office, what you should actually do is you be able to wake up, stretch a bit, walk around, come sit down again. Doing that will help reduce the instances of pain. We do tell them to avoid, in the cases of trauma, our most common means of transport is a motorcycle. But unfortunately, we are the body of the motorcycle. So things like kurushwa kwa bumps, kurushwa kwa motorbike, ukishuka hapo unasikia uchungu. So it doesn't mean that the correction has not been done correctly. It's only that now these activities will help increase the kind of pain that you're feeling before. So we do advise them on the care of the spine that they need to take. You're eating well, you're eating healthy, getting the enough nutrients and supplements that contain things like calcium that will help in the process of healing for this kind of these kind of patients. Yeah.
Okay, thank you so much, Daktari. And of course, now coming to you, Abraham, of course, we're coming to the closure of this particular show. And there is somebody watching, maybe currently they're still thinking of, they've been told they're going for surgery. I know quite a number who are actually watching. Who told me yesterday we'll be watching to just get the inspiration. There is somebody out there who's been told they're supposed to undergo a spine surgery. That they are quite okay, they don't know what to do. They have doubts. Maybe they've been told many other things by so many other people. What would you tell them?
Well, surgery is the ultimate thing. The final, I mean, there is no way the pain will go away without a surgery, especially when the disc has degenerated. Just like me, I didn't want to go for surgery, but eventually the pain was terrible, and eventually I went for the surgery. My advice is that people should not take long. They should heed to the doctor's advice and correct the problem as early as possible. Kwa sababu ukiendelea kukaa sana, that is the more una damage your nerves. The best way is just to accept na kwenda kwa surgery na maisha yako itarudi back to normal without any problem. I remember when I was told not to go for surgery by my friends and family members, it was actually very tough. What made me to go for the surgery was just the pain. The pain ilinipeleka tu mbio mpaka nikaenda nikafanyiwa surgery. Nataka ni advice kwamba yeyote mwenye ako na shida ya spine, don't hesitate. Go to the doctor, chukua MRI and heed the doctor's advice. Kwa sababu the more you continue suffering, the more you are damaging your nerves. Na the more the problem will be hard to solve. Asante sana.
Thank you so much. And of course, if you have any other message that you may want to pass, because I'm sure these would be your closing remarks. If you have any other closing remarks, let me know.
My closing remarks ni kwa daktari. I really want to say thank you very much, Dr. FKH, for what he did for the surgery and the follow-up, because every time I go for review, I get a lot of advice on what to do, what not to do, and all that. Nashukuru sana. And then again, I have a guy who has been assisting me with the physiotherapy by the name Linus Tarus. Yeye amekuwa mtu very close to me. Huyo ndio mwenye amenisaidia kabisa. And my recovery process imekuwa very smooth, simply because of the physiotherapy and taking heed to what the doctors have told me to do. So nashukuru sana Top Hill Hospital for the surgery, and I'm advising that anybody mwenye ako na shida ya if you feel any kind of numbness, don't waste time. Like I'm just thinking, like, if the first person I met when the first doctor I met when I told him that I have some numbness and all that in my leg, huyo daktari kama angechukua tu usukani moja kwa moja na labda pengine tuende kwa specialist, pengine my problem haingefika to a point of surgery. So when you feel anything to do with numbness, nerves and all that, don't hesitate. Just move straight away na uende hospitali, seek services of a specialist who will be able to advise you well. Na at the end of it, pengine utachipata tu hata utafika kwa surgery. Some of the things itakuwa corrected. Some of the things pengine utaambiwa what to do, what not to do. na eventually unapona without going for surgery. So nataka nishukuru sana. Asante sana Topil for taking care of me. Na saizi naendelea na maisha yangu vizuri. You know, I'm 2 and 3 weeks down the line, and I'm now able to move. I'm now able to do my work and all that. So nashukuru sana. Asante sana.
Okay, thank you so much na asante sana kwa kutengeza muda na kuwa na sisi asubuhi ya leo. Thank you so much for blessing the call to be on the Morning Glory show. And now before exiting, of course, Daktari will give us his also final advice. But then before that, Daktari comes from a hospital called Topil Hospital. They actually are the sponsors for this particular Wednesday broadcast, the Healthy, Wealthy, Wise edition. And if you're asking yourself, where is Topil Hospital? I love saying that every way in Eldoret leads to Topil Hospital. You know, Abraham tells me he comes from Burnt Forest. And when you're coming from Burnt Forest, around A22, which people usually call it Uganda Road, around the temple there, around just past Poor Place on the left, when you're coming towards town, there is a signpost there leading you to Topil Hospital. Of course, you'd need to branch around the temple there. If you're coming from the Nairobi Road on the other side, of course, there is also another branch. If you're coming from Kisumu, or rather Kapsabet, Eldoret Road, just past also Nairobi Road, there's also another way there. So Topil Hospital is situated in a serene environment in Delgon View, just next to Boma Inn. And so when you're there, you get enough time to heal. You get a good environment to heal. Their mantra is actually exceptional technology, extraordinary care. In addition to that, allow me to also mention my other sponsors, that is D-Square. Thank you so much, D-Square, for making, of course, for taking part of your resources to support this Healthy, Wealthy, Wise edition, and for making sure that people are not only healthy, but are also looking nice. So if you want to get a nice shirt, a nice suit, you need to get some quality shoes, a beautiful watch, then consider walking into D-Square Fashion House. If you want to take up fashion as a career, visit D-Square School of Fashion Design and Tailoring. And of course, we've been coming live from Dawi Africa Photography, and I've told you that on the 17th and the 18th day of June, we shall be at Rimoi. Kule unaenda unaona the biggest elephants actually. I think it is in the world, found in Rimoi. And in addition to that, as we are going, there are so many other attraction sites. Of course, there's the E10 viewpoint, there's the Torok Falls, and all those other amazing places in the beautiful, magical Elgeyo Marakwet of Kenya. Now, with that, allow me to give Daktari a chance to also give you his final words, especially about today's topic, and any other thing that Daktari may want to tell his people. Karibu Daktari.
Yeah, thank you very much. So, as you heard earlier, I'm a resident medical officer at Topil Hospital. Topil is a brain and spine center. So, I encourage people that have spinal issues, spine issues, back pains, severe back pains, do visit Topil Hospital. Dr. F. Koech is a top neurosurgeon, specialized also in the neurospine. Doctors that are there are trained on how to be able to identify and be able to help you. You've had physiotherapists that are there that are specialized on the spine, on how to help individuals that have spine issues. So on another note, for those people who have visited a doctor and seen a specialist, they have been told that their best option is to go the surgical way for the correction. Yes, there are, I'm sure people have fears and people have troubles. My best advice to them will be, sit down with your surgeon, let them talk to you, let them take you through the process of what they're going to do intraoperatively. Let them understand, ask them any questions you have. They are going to be able to answer you adequately so that you can be able to make an informed decision. There are many myths that are going out there that when you touch your spine, you might not walk again and things like that. But when you sit down with your surgeon, you together with your family, let them be able to explain to you what they are going to do in the operation table and how the recovery process will be, how much you expect, and things like that. It will be able to elevate that kind of fear that people have concerning spinal surgeries. And thirdly, what I like to say is we feel appreciated. We feel good. Most of the times, we as doctors, we sit in a setting whereby we deal with patients every day. And it's usually very encouraging when you have such a success story of someone you've helped, like Abraham and many people out there that you have helped, and they'll be able to go back to their normal lives once again. It encourages us as doctors, because we stay in a situation whereby you see patients every day, and every day we follow up probably in the clinic, but when you come out here and then you hear their stories, you hear them talking about their recovery process, it encourages us. It gives us that kind of feeling good factor that I've actually helped an individual and I've actually changed the life of an individual. That is usually very, very good.
Okay, thank you so much for that, Daktari. And of course, also thank you so much for always making time to be with us on the Morning Glory Show. It is usually a pleasure also to be able to share with our viewers and to bring such conversations on set and make sure that we improve the quality of life. We would want everyone to live a fulfilling life. And so every Wednesday, we are here to talk about health. Tomorrow is the Social Square. We'll be talking about social issues. And of course, feel free also to join us. Friday, of course, is our day for sports and also art. And so from Monday to Friday, the Morning Glory Show engages to make sure that we bring you nothing but the best. With that, my name is MC Kalia, and this has been the Morning Glory Show, coming live from Dawi Africa Photography and produced by Very Nice Media.